action. Drug action can be of many types. It can be stimulation, as in the case of caffeine, it stimulates the brain, or it can be depression, as seen in the case of CNS depressants. It can be irritation, seen in counter-irritants, or replacement, seen in hormone replacement therapy. We can have two types of mechanisms: non cellular mechanisms and cellular mechanisms of drug action. Non cellular mechanisms may involve physical effects, as is seen in some emollients, locally applied agents to skin or mucous membranes, or it can be a chemical reaction. Chemical reaction, as usual, we see whenever we have to neutralize the acid of the stomach by using aluminum hydroxide as a base. But there it can be also seen when we chemically chelate certain heavy metal which are otherwise poisonous ions inside body by using chelating ions like chelating agents like disodium aditate, penicillamine, and dysferroxamine, and likewise. We have physicochemical methods. We have certain drugs which produce their action by physicochemical properties. Say, for example, we have surfactants, which are acting by reducing the surface tension between the two immiscible phases because of their molecules contain two localized regions, one being the hydrophilic and other being the hydrophobic in nature. And such an action is seen with detergents and emulsifiers, antifoaming agents, and some antiseptics and disinfectants also possess the surfactant properties. Some drugs act by changing the composition of body fluids, and this is true with some of the drugs using the colligative properties for their action. Magnesium sulfate as an osmotic purgative or as antiphlogistic, mannitol as an osmotic diuretic, and in a similar way, use of dextran 40, dextran 70 as plasma expanders. We have the cellular mechanisms of action, while we have the physicochemical uh, and biophysical methods, which we see in case of the anesthetics, because they act in the lipid matrix of the cell membrane and thereby distort the membrane by causing the membrane expansion and preventing the function of the membrane proteins. And we have the formation of clathrates, as was believed once, because some of the anesthetic agents are believed to form the clathrates. And we have the next mechanism by altering the membrane structure and functions. And this is especially true with some of the this antifungal agents. They are making the binding with the sterols and making holes in the cell membrane, thereby causing the leakage of the cell contents and also preventing the functioning. And some of the ion channel binding ligands also act through mechanisms that they bind with the membrane structures like ion channels and prevent the flow of the ions across the cell membrane. Then we have some of the mechanisms which are associated with the neurohumoral transmission, we can either prevent the synthesis of the neurotransmitter in the presynaptic neuron, or we can prevent the release. Say this is a mechanism most often seen with the autonomic drugs, and we can also prevent the binding of the neurotransmitter with its postsynaptic receptor, thereby preventing its action. Sometimes the action is brought about by the enzyme inhibition. That is true. Say, for example, we have a carbonic anhydrase inhibition by the acetazolamide, or we have the inhibition of the angiotensin converting enzyme by captopril, enalapril, trondolalpril, and thereby preventing the conversion of the angiotensin to its active form and thereby reducing the blood pressure. But this is again a surprising event that we have some of the drugs which are acting by the enzyme activation. Metformin is the drug used in diabetes that actually acts by enhancing the activity of the AMP kinase and thereby preventing the glucose dynamics. It prevents the extra production of the glucose by the liver and also prevents this enhances rather the utilization of glucose by the muscles by enhanced action of the AMP kinase. The actions are also brought about by altering or by acting on the structural proteins, and is mostly seen in case of some of the what we call the anti-cancer drugs, because these drugs are acting on the microtubules and thereby changing the structure. Let's say tubulin is a protein which makes up of the cytoskeletal element of the microtubules. This is the target of some of the anti-cancer drugs like Taxol, vinblastine, vincristine, colchicine, and cryptophyllin. And beta-tubulin in the enterocytes of the metazoan parasites is the target for benzimidazoles. Then we have receptor mediated actions. And receptors, as we see, they are in the form of ion channels, or a receptor can be a G protein coupled receptor, receptor tyrosine kinases, which have inherent capacity of activating certain kinases and getting autophosphorylated, and thereby phosphorylating the substrate proteins and producing their action. And then we also have intracellular receptors, as in case of certain steroid hormone receptors, or even we have the receptors for the thyroid, for the receptors for the thyroid hormones and other steroid hormones. And this is a general plot of the mechanism of drug action. Thank you.